Welcome to this explainer. Today, we're doing high-yield, deep dive into hepatitis B, and we're tailoring it specifically for your medical exams. We are going to break this thing down so you can absolutely crush it on your boards. Okay, so let's jump right in. Looking at this table, what's the first thing that jumps out at you? It should be that while hepatitis A, C, D, and E are all RNA viruses, hepatitis B is the odd one out. It stands completely alone. It's the only one with a double-stranded DNA genome. And, this isn't just trivia. This fundamental difference is why it behaves so differently in the body, which has huge clinical implications. So, here's our game plan. We're going to go on a master the microbe journey. First, we'll get to know the virus itself. Then, we'll see what it does inside the body, crack the code of how to diagnose it, figure out how to prevent it, and then how to treat it. And of course, we'll wrap it all up with a rapid-fire review of the absolute must-know points. All right, first up, let's get to know our target, the hepatitis B virus, or HBV. You got to know your enemy to defeat it, right? Understanding its structure is really the key to figuring out how we find it and how we fight it. So this is what we're up against. On the left, that's what the virus actually looks like under a powerful microscope. Kind of cool, right? But on the right, that's the diagram you need to burn into your memory for your exams. The whole infectious shebang, that complete 42-nanometer particle, has a name, the Dane particle. Remember that one. Okay, this slide, this is mission control for diagnosis. You have to know these three antigens. Think of them as the virus's name tags. You've got HBsAg, the surface antigen on the outer coat. Then there's HBcAg, the core antigen tucked away inside. And then you have HBeAg, the pre-core antigen. This one's like a secret agent. The virus releases it into the blood, and its presence tells us the virus is replicating like crazy and the person is highly infectious. Just remember S, C, and E. Okay, so now that we've met the virus, let's see how this all plays out in a real person. We need to cover how it gets in, who's most at risk, and, what happens once you're infected. For your exams, they love mnemonics, and this one is a classic. It's an easy win. Just remember the 3 B's for how hepatitis B is transmitted. First up is blood. Think needle pricks, transfusions. Second is the bedroom, so sexual contact. And third is birth. That's when it passes from an infected mother to her baby. Blood, bedroom, birth. Got it? And if you know the 3 B's, well, then the high-risk groups just make perfect sense. It's totally logical, right? We're talking about people like surgeons who are around blood all the time, IV drug users, people who need a lot of blood transfusions, and of course, people with multiple sexual partners. It all connects back. Now, this chart maps out what can happen after someone gets infected. But here is a super important concept, something that often trips people up. The HBV virus itself doesn't actually go around blowing up liver cells. The real damage, the hepatitis, is actually friendly fire. It's caused by your own immune system. Your killer T cells see the infected liver cells and attack them. So a really strong immune response clears the virus and you recover. A weak response, not so much. The virus sticks around and you end up with a chronic infection. And this is a classic exam question, so listen up. The outcome of the infection totally flips depending on how old you are when you get it. Get this, over 90% of healthy adults will fight it off and recover completely. But for infants infected at birth, it's the exact opposite. About 90% of them will develop a chronic infection. Why? Because their little immune systems just aren't mature enough to put up a good fight. Okay, deep breath. We've arrived at the main event. If you're going to master just one part of hepatitis B for your exams, this is it. Understanding these serological markers, it's completely non-negotiable. This is where the points are. Seriously, I'm not kidding. Mastering these markers is mastering hepatitis B. You are guaranteed to see questions on this, so let's make sure we make it crystal clear. Okay, don't let this graph freak you out. It's not as scary as it looks. It's actually just telling a story over time. You got time after exposure on the bottom and the level of these markers on the side. We're just going to trace each of these colored lines and see when each character, each antigen and antibody shows up, when it peaks, and when it goes away. This graph tells the entire story of the infection. So here's how the story unfolds. First, HBsAg pops up. That's the bad guy on the scene. It means active infection. Shortly after, HBeAg appears. That's our high infectivity flag. Then your body starts to fight back, and the first antibody it sends out is Anti-HBc IgM. That's the signal for an AC infection. As your immune system starts winning, Anti-HBe shows up. And finally, the hero arrives, Anti-HBs. This signals long-term immunity, either from beating the infection or from vaccination.
And remember this key fact: if you're immune just from the vaccine, anti-HBs is the only marker you'll have. All right, theory's great, but let's get practical. This table is exactly how they'll test you on the exam. They'll give you a list of results, and you have to be the detective. You look at the clues, the pattern of positive and negative markers, and you solve the case. So if HBsAg and Anti-HBc IgM are both positive, boom, acute hepatitis. If only Anti-HBs is positive, that person is immune from the vaccine. It's all about recognizing these patterns.
So we know how to spot the enemy, and we understand its battle plan. But how do we stop it from ever getting through the gates? It's time to talk prevention.
We've got two main strategies, and you have to know the difference. Think of it like this. Active immunization, the vaccine, is like teaching your body how to fish. You give it a piece of the virus, the HBsAg, and it learns to build its own army of antibodies that'll last a lifetime. Passive immunization, using something called HBeAg, is like just giving your body a fish. You're injecting pre-made antibodies for an immediate but temporary fix. We use this after, say, a needle stick injury, or for a baby born to an infected mom. But what happens when the virus gets past our defenses and decides to set up camp for the long haul? For those who develop a chronic infection, prevention is too late. So we need to talk about treatment. This table really shows you the evolution of treatment. Back in the day, we used interferon alpha. Think weekly injections and a whole lot of side effects. It wasn't fun. But today, it's a completely different ballgame. The first choice now is simple oral antiviral pills, like tenofovir. They're taken every day, they work great, and they have very few side effects. For your exam, if they ask about treating chronic Hep B, the answer is oral antivirals. All right, we are in the home stretch. We've covered a ton of ground, so let's do a final rapid-fire briefing. If you're cramming the night before your exam, this is the slide you need to have absolutely locked in your brain.
Let's do this fast. Ready? HBV is the only DNA virus. HBsAg means you're infected. HBeAg means you're highly infectious. Anti-HBc IgM means it's acute, and anti-HBs means you are safe. Either you recovered or you got the vaccine. The biggest risk for chronic disease is in newborns, around 90%, and the treatment we use for chronic cases is oral antivirals like tenofovir. Got it? Good.
And to wrap this up, I'll leave you with a classic clinical scenario to chew on. A baby is born. The mother is not only infected, she's HBeAg positive, meaning she's incredibly infectious. The clock is ticking. What is your immediate plan to protect this newborn? Think about everything we just talked about, active versus passive immunity. The answer is right there. You got this.